From the Toronto Star, I'm Adrian Chung, and this matters. You know the line. Those who do not learn history are doomed to repeat it. History from earlier this year is already repeating itself. The Toronto Star is reporting data from Toronto Public Health that shows, in the second wave, the city's racialized and lower-income residents are disproportionately affected by COVID. That means more cases, more deaths, while making up a smaller percentage of the population, the same pattern as the first wave. The Toronto Star's health reporter Jennifer Yang and science and technology reporter Kate Allen are talking about what the numbers show us about who is being hit hardest and why, and the different ways health experts say we can fix it. Jennifer, Kate, thanks for joining the podcast to talk about this.
Thanks for having us.
Thanks, Adrian.
The reporting you've both done is outstanding, and it uses the data of the second wave to tell a very clear story about who is most affected and why. So let's start there. Jennifer, I'll begin with you. What do the positive cases tell us about who is being hit hardest?
So what we did this week is we took a huge and really important data set from Toronto Public Health that has case information for every single infection that's been confirmed in Toronto. And it also links those people to the neighborhoods where they live. And because we have access to Statistics Canada census data, we can understand a lot about the demographics of these people. What we found was really dramatic. We basically focused on the 20 richest neighborhoods and the 20 neighborhoods with the fewest visible minorities, in other words, the 20 whitest neighborhoods. And we compared infection rates in those groups with people who live in the 20 poorest neighborhoods and the 20 neighborhoods in Toronto with the most racialized people or visible minorities. And what we found was really stark. Basically, people living in the poorest, most racialized neighborhoods were being infected at dramatically higher rates than people who live in the wealthiest, whitest neighborhoods of Toronto.
And it shows clearly the inequality, not just in our city, but how people are experiencing this pandemic.
Yeah, what the numbers really tell is the story of who's been able to stay home and who has been unable to stay home and stay safe. Basically, who's had to continue working and going out in the world, doing their jobs versus others who've maybe had the luxury of being able to work from home and hunker down. And so it really does tell the story of the uneven way in which this pandemic has played out across our city and who's been impacted more than others.
Kate, the reporting that you guys have done as well shows that these numbers are essentially identical to the first wave. We knew that in racialized, poorer communities, people were being hit harder. What haven't our political and public health leaders learned from the first wave?
Yeah, I mean, that's kind of a hard question. But if you go back to March, when, the pandemic kind of first burst onto the scene here, we really didn't know anything about the virus. We didn't know much about it at all. And so we just kind of shut down everything, right? We shut down schools, we shut down all kinds of businesses, we shut down pretty much everything that wasn't deemed essential. It took a while, but the case curves eventually started falling. But what we discovered when we did similar work to this in the summer is, this exact pattern that basically the lockdown measures worked almost immediately in richer, whiter neighborhoods. Like it flattened seriously the week that those measures were implemented and stayed low for the whole first wave. But the case curves in the poorer, more racialized neighborhoods stayed super high for weeks and weeks after the lockdown was implemented in March. So, we know a bit more about the virus now. We obviously asked this question of both Toronto Public Health and the provincial government, why hasn't this obvious inequity been the center of the pandemic response? And it's a hard question to answer. I think one thing we heard back, at least from Toronto Public Health, is that a lot of the differences here are because of really deep systemic inequalities. So in other words, who holds essential but often very low paying jobs And as a result, often can't afford suitable housing, for an entire family. So it's a question of sort of like who is forced to still go to work and then who doesn't have adequate space to isolate if they do become infected. And so one response we got was just sort of like, these are very deep systemic issues that are hard to solve quickly. And that may be true, but also the health experts that we spoke to said that there are still things that we could have done and should have done and had all summer to do in order to prepare everybody in the city, not just rich people who get to work from home, but everybody for a second wave that we knew was going to come and that epidemiologists warned was likely to be worse than the first wave.
Yeah, you included a quote in the reporting that really struck me, which gets at what you're talking about there, that this idea of systemic racism, for some people, it's a really big idea, but this is actually how it translates in real life.
Sure. I mean, I think one thing that certainly community groups that work in the neighborhoods that we're talking about, these like much harder hit neighborhoods, it's not like they don't know what the problems are and what the solutions are. Like they've been sort of waving their hands all summer. And the city of Toronto has said that they are working more closely with community health organizations and other community agencies now. But I mean, I think a lot of health experts and advocates would argue that these community organizations who know these neighborhoods best aren't being resourced to sort of roll out the solutions that could really help.
Right. So as we speak about this, Toronto and Peel region are both in lockdown. That is a blanket response to, understandably, a concerning jump in cases in the second wave. But health experts that you've both spoken to say that that is an answer that is not targeted enough. Jen, I'll go to you. What do they mean by that?
So lockdown applies to the entire city of Toronto, the entire region of Peel. And it's really a one-size-fits-all blunt instrument. But we know from our data and from other data and many reports and studies that this pandemic has been hitting different pockets differently. So what's needed is just extremely targeted measures that is going to protect the people who are getting hurt the most in this pandemic. And that's known. So what people are really advocating for are measures that are going to address some of those structural issues that Kate was talking about and more powerfully protect people who are on the front lines and getting exposed to this virus. And really just comes down to income. It comes down to having money in the bank, money in your pocket so you can make your rent, feed your kid, do all the things that you need to do to survive and thrive and keep your family safe and healthy. And at the end of the day, people who make the least money in the city are having to make difficult choices between staying home, self-isolating, and taking actions that are going to protect not just themselves, but the general public. They're having to make choices between that and potentially, making their rent or having food on the table for their family. So the most direct way to help people do what they need to do to stay safe is really putting money in their pocket so that they can afford to take the steps they need to take. So, experts are advocating for things like protections from evictions and paid sick leave. We know is very inaccessible to people who make the least money, who are paid the least amount of money to do these essential jobs. Those are two things that people have been calling for very loudly for a very long time that is still not a piece of this current second lockdown strategy.
Kate?
So I just wanted to add that this doesn't mean that the restrictions that have been implemented so far are useless. It's not that they haven't worked at all. It's just that they only have been, noticeably effective for a part of at least the city of Toronto. And that's the more affluent, whiter, more downtown neighborhoods. And the measures implemented over the course of the fall were sort of, targeted at indoor dining, like restaurants, bars, gyms, stuff like that. And that is where some people are getting infected, but those people are mostly in downtown, whiter, more affluent areas. And so that's where we've seen the curve bending after these measures were implemented. But people in these poorer, more racialized neighborhoods, that is not where they're getting infected. They're not going to the gym, like they're going to their jobs. So these restrictions just aren't, as Jenny said, they're just not targeted enough at the people who are hardest hit.
Right. That quite often racialized poor people, they have no choice but to work, that they are often essential workers. They often have to take public transit. They have less options than people who get to work from home or have a higher income, essentially.
Yeah. And that's something that we heard from community health leaders as well, that sort of the message from public health, which has been stay home, it's like meaningless because they not only can they not stay home, we're asking them not to. Like, we're asking them to go to work in jobs that let everybody else stay home, like things that, just keep society running, or even like make things that allow food delivery to happen, things like that. So it's not just that they can't stay home, it's like enabling everybody else to stay home. So, I mean, that's another sort of acutely unfair piece of this.
We'll be right back. Jen brought up that advocates are talking about addressing paid sick leave and how that can actually play a huge role here. What does the data tell us about how paid sick leave is actually working right now?
So it's really hard to get good data looking at access to paid sick leave. A lot of the most precarious workers, are not well documented or not captured by Statistics Canada surveys. But we do have access to something called the labor force survey, which is basically just people getting called every month and being questioned about their employment. So we got sort of new data that I haven't seen published before, looking at who's been able to access paid sick leave since the pandemic began in March. And what we saw there was that the people who make the least amount of money, so earning $17 an hour or less, only 17% of people in that income group who took a week of sick leave were paid to take time off. And that's compared to people in the highest earning group, of which 47% were paid to take a week off because of illness or disability. I mean, that's still not great. That's less than half. But you can really see that the same income group that is most likely to get COVID is also the least likely to get paid to take time off if they're sick. So that's the gap, when the key to controlling an epidemic is so hinges upon individuals taking actions to stay home and self-isolate, but you do not enable those people to actually take that step because, their livelihoods depend on going to work, then it's just not going to work as a public health strategy. That's why advocates say that paid sick leave is going to be the most powerful tool that we could apply to helping low wage earners actually stay home when they need to and not worry about losing their jobs or losing their homes.
Right. That if somebody's financial life is at stake, meeting rent, for instance, they're not going to self-isolate because they cannot do that if they lose their job, if they're not being paid for that time off, essentially.
Exactly. And, if you think about it, how many times have we all gone to work feeling a little bit unwell? But the thing with COVID is that research is now showing that people can be infectious even 2 days before they have symptoms developing. So the first sign of feeling unwell is really when you need someone to already be staying home and getting a COVID test and then self-isolating until that result comes back, hopefully as negative. So any barriers we put between them being able to do that is going to create a riskier environment in their workplaces. And, it's a lot of people who make hourly wages, low wages, are living paycheck to paycheck. Taking one day off work could make the difference in terms of making their rent. So if you're asking people to do what they need to do, to protect both their own health and the health of their coworkers, there has to be a seamless solution that helps them take that time off, even if they suspect that they might need to, well before they have that positive result in hand.
Kate, so much of your reporting has focused on looking at the pandemic through this socio-economic lens over the past 9 months. Of all the stories and the reporting that you guys have done, what is the bigger story about these conditions that are happening right in our city?
The bigger story. I mean, something that a doctor, researcher, epidemiologist said to me that really resonated, and that I think was in the first or second or third paragraph of our story, is that inequality is central to this pandemic. It is the central sort of feature of this pandemic, but it is not the central feature of the response to the pandemic. And until we make it the central feature, we'll continue to struggle throughout the winter. Because of course, for all the reasons we've just laid out, we should be helping everybody stay safe in the pandemic, especially people that we've asked to stay working on the front lines to keep our society running. But also, it hurts everybody if lockdown restrictions drag on and on and on because we're failing to get infection rates under control. So, it really hurts everyone here, aside from the, essential unfairness of who we're putting most at risk. Of course, this pandemic, these aren't new problems. The fact that there are two Torontos, two cities sort of operating in side by side is not new. But the pandemic has really exposed and exploited those deep, deep, deep fissures in our society in a way that I think has made it, hard to ignore for anyone who might have tried before now. So I certainly hope that these are problems that everybody continues to pay attention to long after the pandemic is over.
So we now have 9 months worth of data about who is being hit hardest, and for all the reasons we've just talked about in this conversation. If we know that from the first wave, are governments failing to act?
I think that's what a lot of people would say, especially people in these communities who've been working on these issues for so long, calling for change for so long. One of the women that we interviewed for this story is Sane Dubé, and she said something, really profound to me in our interview as well. She said that the fact that we know now that this pandemic is sickening and likely killing Black and racialized people more than, white, wealthier people, the fact that we know that and have failed to take the steps to address that is an example of systemic racism in action and is a message that some lives in the city are valued more than others. So her position really is that if we continue to ignore this and continue to avoid taking the steps that will actually address these issues, then the message is very loud and clear and very, obvious that there are value judgments being made in this pandemic response over whose lives will be protected and which ones are being treated as more expendable.
Kate, Jennifer, thank you so much for your continued reporting on this.
Thank you.
Thanks for having us on, Adrian.
That is the Toronto Star's Kate Allen and Jennifer Yang. For more on this story, you can find Kate and Jennifer's data reporting and more in-depth coverage of COVID-19 at thestar.ca. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Chung, Saba Aitazaz, and Raju Muthar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.